Personality disorders are mental health conditions that impact an individual's thoughts, perceptions, emotions, and social interactions. Antisocial personality disorder, or ASPD, stands out as a particularly challenging type of personality disorder marked by impulsive, irresponsible, and often criminal behavior. Individuals with antisocial personality disorder tend to be manipulative, deceitful, and reckless, showing little regard for the feelings of others. This disorder falls on a spectrum, ranging from occasional poor decision-making to repeated law-breaking and serious criminal activity. Antisocial personality disorder is also commonly referred to as sociopathy. The cause of antisocial personality disorder is currently unknown. Genetic factors and environmental factors such as child abuse are believed to contribute to the development of this condition. Individuals with an antisocial or alcoholic parent face an increased risk. The condition tends to affect more males than females. One of the main driving factors contributing to antisocial personality disorder is associated with brain biology, specifically abnormalities with serotonin levels, a chemical that regulates mood and happiness, can lead to the development of behaviors associated with this disorder. Changes in serotonin levels in the brain may manifest as antisocial personality traits. While the exact cause of antisocial personality disorder is unknown, researchers suggest that genetic and environmental factors can influence its development. Previous studies have reported varying heritability estimates ranging from 38 to 69%. Adverse childhood experiences such as physical and sexual abuse, neglect, and childhood psychopathology are some of the environmental factors linked to the development of antisocial personality disorder. Various studies underline the significance of both shared and non-shared environmental factors, such as family dynamics and peer relations, which play a crucial role in the development of antisocial personality disorder. Researchers are actively conducting studies to identify the specific gene contributing to antisocial personality disorder. Evidence suggests that the 2p12 region of chromosome 2 and variations within ABPR1A may play a crucial role in the development of this disorder. Furthermore, the interactions of specific genes with the environment have also been a focus of study. Evidence suggests that variations in the oxytocin receptor gene, OXTR, contributes to the broad range of behavior seen in individuals with antisocial personality disorder, due to its impact on the influence of deviant peer affiliation. Individuals with antisocial personality disorder often demonstrate the ability to appear as witty and charming. They come across as being skilled as using flattery and manipulating the emotions of others. They frequently engage in criminal activities and tend to disregard their safety as well as the safety of others. Substance abuse is also a struggle for them, and they frequently lie, steal, and engage in physical alterations. These individuals typically lack feelings of guilt or remorse and may exhibit anger or arrogance in their interactions with others. Onset typically occurs before the age of 15. The estimated lifetime prevalence of antisocial personality disorder in the general population ranges between 1 and 4%. However, due to the predictive nature of an initial conduct disorder diagnosis before the age of 15, it is frequently under-evaluated. Within the general population, males are typically 3 to 5 times more likely to be diagnosed than females, affecting approximately 6% of men and 2% of women. There are currently no diagnosis tests that are accepted for diagnosing antisocial personality disorder. However, genetic testing and neuroimaging are used to evaluate potential causes and patterns associated with antisocial personality disorder. Individuals diagnosed with antisocial personality disorder are more likely to contract viral infections and sexually transmitted diseases associated with high-risk behavior, such as hepatitis C and human immunodeficiency virus, or HIV. Additionally, they are at a higher risk of mortality due to accidents, traumatic injuries, suicides, as well as homicides. Antisocial personality disorder is challenging to treat. However, for some individuals, treatment and close follow-up over an extended period may prove to be beneficial. Oftentimes, individuals tend to believe that they don't require any assistance, which makes it more difficult to treat. The effectiveness of treatment is dependent on the individual's situation, their willingness to cooperate in a given treatment, and the severity of their symptoms. Psychotherapy and cognitive behavioral therapy, CBT, are sometimes used to treat antisocial personality disorder. Therapy may include anger and violence management, addressing issues with alcohol or drugs, and treating other mental health conditions. Talk therapy may not always be effective, especially if symptoms are severe and the individual is unwilling to acknowledge their contribution to serious problems. Mentalisation-based therapy, MBT, is a relatively new approach in which the therapist encourages the patient to consider their way of thinking and analyze how their mental state impacts their behavior. Treatment is typically done on an outpatient basis, as psychiatric hospitals tend to play a limited role in these situations due to an individual being potentially disruptive in the type of setting. Hospitalization would only be necessary if the individual is exhibiting behavior that coincides with homicidal thoughts. There are no medications approved by the Food and Drug Administration to treat antisocial personality disorder. Healthcare providers may prescribe medicines for conditions that sometimes occur alongside antisocial personality disorder, such as anxiety or depression, or for symptoms of aggression. Borderline personality disorder can be mistaken for antisocial personality disorder, as individuals share some overlapping traits. It is important to note that individuals with antisocial personality disorder may struggle with emotional regulation and display higher levels of aggression than normal. Another common personality disorder to consider is narcissistic personality disorder, characterized by superficial and exploitive behaviors as well as lack of empathy. It's crucial to note that committing crimes is not always indicative of antisocial personality disorder. A diagnosis of antisocial personality disorder is only possible if an individual exhibits maladaptive signs that result in subjective distress. Most helplines are geared towards those with either substance abuse, victims of violence, or relatively common mental illnesses such as depression or anxiety. However, Bounce Back is a free CBT program that offers guided mental health self-help support for those 15 and older. Considering the nature of the illness, it calls into question how helpful a helpline might be, and other therapies should be considered instead. That is all. Thank you for listening.